Stop. If your blood sugar is climbing despite perfect compliance, what I'm about to tell you will either make you furious or finally set you free. For 24 years as a surgeon, I've watched patients follow every rule, take every medication, restrict every food, and still watch their numbers spiral. And here's what nobody is telling you. You're not failing, your doctors aren't lying, but you're all fighting the wrong enemy. Right now, at this exact moment, there's a 90% chance your cells are rejecting insulin, not because of what you ate, but because of something so basic, so obvious that it's been hiding in plain sight for decades. The medical system won't prioritize this because there's no drug for it, no procedure, no billable code. But I have seen it drop fasting glucose by 50 points in 2 weeks without changing a single meal. I'm Dr. Megan Foster, 24 years of surgical and clinical experience. And what I'm about to show you isn't experimental. It's not controversial. It's physiology that's been deliberately ignored because it doesn't generate profit. This is the variable that determines whether insulin can do its job before food or medication ever enter the equation. And if you've been told your only option is more restriction or higher doses, that ends today. Here's what's happening. The problem is often not what you're eating. It's how hydrated your cells are. Blood sugar doesn't rise only because glucose enters the bloodstream. It rises when glucose can't get into cells. And one of the fastest ways insulin stops working properly is cellular dehydration. Same meals, same medications, very different biological response depending on hydration status. That distinction changes everything. This is not about replacing your treatment. It's about restoring the internal environment your treatment depends on. By the end of this video, you'll understand why fasting glucose becomes unpredictable with age, how hydration timing affects insulin sensitivity more than hydration volume, why cold water can actually worsen morning readings, and how a simple hydration structure can stabilize blood sugar without adding a single restriction to your life. This is realistic, this is physiology-based, and you can start today. Now, before we go further, if this kind of calm, science-based guidance matters to you, consider subscribing. I read every comment, and if this resonates as we go, just type approved and I'll know this helped. Let's get into what's really happening and why hydration matters more after 60 than almost anyone explains. Most adults over 65 are chronically dehydrated, even if they don't feel thirsty. That's not an exaggeration. It's measurable. And dehydration makes blood sugar control unnecessarily difficult regardless of diet or medication. Yet, hydration timing is rarely discussed in diabetes care. It's treated as optional as general wellness advice. But it's not optional, it's foundational. As we age, 4 things change that make hydration harder. First, cellular water channels called aquaporins become less responsive. These are the gatekeepers that let water into cells. When they slow down, cells can't hydrate efficiently even when you drink. Second, kidney filtration efficiency declines. Your kidneys can't conserve water the way they used to. Third, thirst signals weaken and delay. By the time you feel thirsty, you're already significantly dehydrated. And fourth, common blood pressure and diabetes medications pull water from the body as part of their mechanism. You can be profoundly dehydrated without knowing it. No dry mouth, no obvious signs, just rising blood sugar that no one connects to hydration. Here's why that matters so much. Even mild dehydration makes cell membranes more rigid. Rigid cells resist insulin. Glucose stays in the bloodstream not because you ate wrong, but because your cells physically can't accept it. Insulin is like a key, but if the lock is stiff, the key doesn't work. That's why your numbers rise despite doing everything right. The food isn't the problem. The medication isn't failing. The environment inside your body is changed. And once you understand that, everything else starts to make sense. Let me give you an example. Mark 72. Mark's fasting glucose had been stable for years, consistently in the 120s. Then suddenly it climbed into the 180s. No diet changes, no missed medication, no explanation from his doctor beyond age and disease progression. When we looked closely, he was drinking fewer than 2 glasses of plain water per day. Everything else was coffee, which is a diuretic, or juice, which spikes blood sugar. We adjusted hydration timing and temperature only, didn't change his food, didn't adjust his medication. Within 2 weeks, his morning readings dropped into the low 30s and stayed there. Same food, same meds, different hydration strategy. That's the power of addressing the right variable. Now, here's the core insight I want you to hold on to. Blood sugar instability is often a volume problem, not a food problem. When cells are hydrated, insulin works. When they're not, nothing else matters. You can eat perfectly. You can take your medication exactly as prescribed. But if your cells are dehydrated, glucose has nowhere to go. It's like trying to pour water into a bottle with the cap still on. The water isn't the problem. The bottle is sealed. And yet, most treatment plans focus exclusively on what you're pouring, never addressing whether the bottle can actually open. Let me show you the 3 most common hydration mistakes people make after 60, mistakes that quietly worsen glucose control every single day. First, counting coffee, tea, or juice as water. These fluids have effects on the body. Coffee is a diuretic. It pulls water out. Juice spikes blood sugar. Tea can be fine, but it's not the same as plain water for cellular hydration. Your cells need water, not flavored liquid. Second, drinking ice-cold water, especially in the morning. Cold water causes vasoconstriction. Your blood vessels tighten, that reduces circulation to cells and slows glucose uptake. Room temperature or slightly warm water improves absorption significantly. And third, drinking large amounts only once thirst appears. By the time you feel thirsty, you're already dehydrated. Your cells are already resistant. You're trying to catch up instead of staying ahead. These patterns are invisible. No one told you they mattered, but they do. So what's the solution? I call it the WTR protocol. W for water quality, T for timing, R for regulation, and adaptation. Let's break it down step by step so you can implement this starting tomorrow. First, water quality. Filtered water is ideal. Tap water works, but filtered removes contaminants that can affect absorption. More importantly, minerals matter, especially magnesium, potassium, and sodium. Why? Because glucose transport is electrical. Insulin signals cells to open. That signal is electrical. Without minerals, the signal weakens. A simple trace mineral addition, a pinch of sea salt, or a mineral drop improves cellular hydration dramatically. You don't need expensive products, just mineralized water. Now, timing. This is where most people get it wrong. It's not about how much you drink, it's about when. There are 4 hydration windows that stabilize blood sugar better than random drinking throughout the day. First, immediately upon waking, room temperature 12 to 16 ounces. This rehydrates after the overnight fast, reduces cortisol-driven glucose release, and primes cells for insulin sensitivity. Second, 30 minutes before meals, 8 to 12:00. This improves blood flow to the digestive system, slows carbohydrate absorption, and prevents post-meal spikes. Third, mid-morning and mid-afternoon, 8:00 each. This maintains circulation and prevents the gradual dehydration that causes afternoon blood sugar variability. And fourth, 2 to 3 hours after your last meal, ATO. This supports overnight kidney function without disrupting sleep. Same water, different timing, different outcome. Here's why timing works. It improves blood flow. Hydrated blood is less viscous. It moves faster. It delivers insulin to cells more efficiently. It reduces cortisol-driven glucose release. Dehydration is a stressor. Stress hormones raise blood sugar. Hydration lowers stress response. It slows carbohydrate absorption. Water before meals dilutes stomach.